Oxford really hits close to where I am. My daughter rides with many students who attended there. And so my approach with her has been lots of open-ended questions. How are you feeling? Not, are you okay? Because I want to try and get them to talk. What do you think about this? How did it feel when you found out your friends were okay? Just, I want to try and get them talking. Young kids are usually easier to tell. Teenagers sometimes will keep their feelings really close. So just letting them know that you're there to talk and try those open-ended questions. And sometimes they're going to ask you tough questions and you just have to have an honest conversation about it. I also tell my kids, you have to be careful what's in the news. They're there to sensationalize and, get viewers. And we have to put things in perspective. Oxford, horrible tragedy. The new variant, is it bad news? Yeah, but we still have masks that are going to work and protect us. So the world is not ending.
That's really helpful advice, Dr. Cunningham. Thank you. Especially for our parents, with older kids. I think that idea of asking open-ended questions so that it forces a conversation is a really, really helpful.
And I think it's so important when families eat meals together, especially dinner, at least a few times a week. There's so much data that it helps kids avoid drugs, avoid getting into trouble, and it's the perfect time for these conversations. I also like talking to teens in the car because you're not making eye contact, and when you're not staring at each other, they talk a heck of a lot more.
So true. So true. Wonderful. Well, let's start talking a little bit more about COVID-19 and why are we seeing an increase in cases, children's cases?
Well, we're seeing an increased number of cases throughout the whole state. It's not just in children. And, I was at the mall recently. I had to go to Target, the grocery store. People are not wearing masks. And I understand people are tired of this, but if you're not vaccinated, you definitely need to wear a mask. But even if you're vaccinated, there's enough COVID. Everyone should be doing it. I just don't see people wearing masks. It's not a political thing. To me, this is just the science. I'm wearing a mask when I go to the grocery store. I'm running errands out there. It's easy enough to keep a couple in the car and I just put them on.
We're now starting to see this blended environment of kids who are vaccinated versus kids who are partially vaccinated versus kids who are not yet vaccinated either because the families haven't chosen to do it yet or they're too young. How do we help our kids manage that? Because they're talking about it too, right? So how do we help them manage and understand that there's still a range, much like we adults have to do?
There is. I think one of the conversations is important that we have a lot of liberty in this country and people make decisions what they feel is best for them and for their children. So I'm not trying to cast anyone in a good light or bad light. It's just a fact. I like to just, when my kids ask me, I give them the good websites like CDC, American Academy of Pediatrics, Henry Ford, where it's good information. I want them to be able to see it for themselves rather than hearing it from the parent, and let them ask questions. That's the best thing to do. I've actually really been happy about how many kids 5 and older that when we're seeing them in clinic, they're actually excited to get the vaccine and they're happy to help get that sense of safety. And again, the young kids aren't the ones who really wind up in the hospital very often, but they do bring it home to mom, dad, and grandparents.
Yeah, absolutely. It was a conversation we had to have as a family that just because you're vaccinated doesn't mean you can stop wearing your mask, to your first point, right? It's just an understanding what that means. As we're getting into, a new variant coming into play, can you just tell us very basically, how do we identify these new variants and kind of what is a variant?
So every time viruses and bacteria start copying themselves, they sometimes make mistakes. Sometimes the mistakes make it a stronger infection, sometimes a weaker infection. This newest variant is significant because it has lots more mutations than we've ever seen in any single COVID. There's just so many more there, and that's what the concern is. It was first detected in South Africa. I just looked at the country South Africa's COVID cases, and they've really shot up over the past 5 days. So unless we're wearing our masks and getting vaccines, I suspect we're going to see something similar.
That's the scary part, right?
Yeah, and I don't want to scare people, but the masks are an easy way to protect ourselves.
As far as this particular variant goes, maybe it's too soon to know, but is it as, Delta was a very strong variant. It had a big impact. What do we know about this one so far?
This has the same mutations as Delta in terms of how easy it is to transmit it. A lot of what we focus on is on the spike protein. This is the part of the virus that binds to certain human cells so it can invade us. And there's a lot of mutations in that spike protein. It looks like people who had COVID in the past, an infection, can easily get sick again with this one. We don't have great data yet on the vaccines in this variant. There's some computer modeling that suggests the vaccines will still be pretty good against severe disease. So I'm still pretty hopeful that we can nip this in the bud.
And can you explain what ivermectin is and how it?
Ivermectin is a drug that treats parasites. So for those of us who had high school biology many years ago, you have bacteria, you have viruses, you have animals and plants. Parasites are kind of their own little category. Things like roundworms, very common parasites in other countries. Occasionally we have pinworm in this country and we can give a dose of ivermectin. Occasionally we'll use it for scabies. There's some people who advocate using ivermectin to treat COVID. And to be fair, in the test tube, it does seem to work. The problem is the levels of ivermectin you would need to treat COVID in a human person are far higher than the toxic level, which means it can make you have seizures or even die, which is why we're not using it. There's just no good data in human beings that it's effective.
Okay, so while we're hearing about it, that helps. So it kills it in a test tube, but in a human body, it would take so much that we would actually make ourselves sick.
Absolutely. And the number of poison control calls across the country have gone up for ivermectin overdoses because you can get it you can get it for certain animals that you keep in glass tanks, and you can get it for veterinary supplies, and then humans take it, it's the wrong dose, and they wind up in the emergency room.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.